Hi, my name's Dr. Lisa Staudt, and I have a clinic along with two business partners. It's a standalone clinic with the Advanced Arthritis Relief Protocol and regenerative medicine therapies that we can offer through IPS. But I also come from another side of things. Previously, I have a background as a chiropractor, but I had sold my office a couple years ago due to some degenerative changes in my wrist that were creating me a lot of pain, and I had an offer to buy my office, so I figured there might be another direction that I was meant to go. So a year or so ago, I was working as a clinical consultant, basically sharing the AARP program with other chiropractors, physical therapists, medical doctors, anyone looking that they could integrate this protocol into their office. And I was seeing how the protocol was working, talking to a lot of other physicians, how successful it had been over the years, and I started thinking about what would it look like to have a standalone clinic. And after just seeing the docs that were excited, I decided to move forward, myself and two business partners. So it took several months to get that up and running just because we had a newer space that needed to be built out, and then that gave us time to start, hiring and doing all the behind the scenes work on getting credentialed and corporation and everything that goes into that new business. So it took quite a while, but we've been open now a couple months. So very excited about that. And we have a beautiful space. We ended up hiring a PA, which was needed in Nebraska, so a physician's assistant. We had training early in January. We ended up having 3 days of training. Typically it's 2 days, but we opted to have a third day added on because we did a little bit more PRP and some aesthetic training. But the 2 days was amazing with our physician assistant. I think she became very well prepared in not only understanding how to talk with the patients and do a consultation and explain the protocol, along with her x-rays, her examination, and even the techniques then for doing the actual injections and the arthrogram. She made just huge progress in those 2 days. Not coming from an orthopedic background in her previous position, this was huge that she was able to learn that because the trainers with IPS are amazing. Both Heather and Dr. Domingo do an excellent job working with the clients and the nurse practitioner or PA, whatever it has. So she felt very well prepared for patient care right away. They worked with her extensively on the notes and the coding as well. So we were able to get up and running. But beyond that, have there been a million other questions that we've had from IPS over the first couple months? Absolutely. And I have to say they've been there to hold our hand and help us through everything that we were still having questions about or learning about, and very responsive to helping us get to that space and to the point that we're comfortable with things. So that has been a great experience. I would have to say it's been one of the greatest learning curves of my life, coming from a chiropractic background, more into this integrated model, but we are getting there along with the help of IPS. So overall, very happy. We moved forward and opened this clinic. I think there's a lot of upsides. Not only are we already seeing patient results, the program is excellent, and how can we give an option for those patients that are really not wanting to do any further cortisone shots or move down that path of total knee replacement. So excited not only for that, helping more people, that's number one, but then the upsides of the business potential are definitely there. We're starting to see the reimbursement, which we know would take a little while, so that's great. And just knowing where we can take this and what other things we could add down the road is exciting. So overall, though, very very happy that we moved forward with IPS to open this clinic, and just very happy that I've had an opportunity to work on the other side of things with Lance and Dr. Shepard as a consultant to share this program with other physicians and show another way to help their patients, and also add a different revenue stream so they can work with a wide variety of patients, but also then, look at how that can help their business. So it's been a win-win on both sides of it, and I just look forward to further growth and learning through Lance and his team. Thanks so much.